I'm Dr. Jim Coyle, and this tutorial in the Challenges in Human Behavior series focuses on assessing and treating mental illness. First, it's helpful to compare assessment versus diagnosis. Social workers who are familiar with mental illness symptoms are able to make informed assessments that lead to appropriate intervention for the client. Diagnosis, which is the use of specific symptom patterns to identify specific mental illness disorders as described in the DSM-5, they're often important for medication and for specialized treatment. So referring the client for a diagnosis is ethical practice for Ontario social workers. I'm going to talk about tools that are used for assessing mental illness in order to have you more familiar with the ideas, the concepts, because there's insufficient time to teach you how to use the tools. But first, it's important to know the meaning of symptoms. For example, affect is an observable feeling state versus mood, which is a pervasive, sustained emotion. A delusion is a firmly held false belief despite contrary evidence, while a hallucination is a perception without external stimuli. Thought disorder refers to impaired thinking about reality, such as you see in psychotic disorders or schizophrenia, whereas mood disorder is about a pervasive feeling, such as depression or anxiety. The mental status exam is the primary tool used to assess elements that may indicate possible mental illness. Mental status examines a number of different facets that a person presents. Anything unusual about their appearance, their attitude. It could be cooperative, guarded, angry, seductive. Their consciousness or alertness, their orientation to person, place, and time. Memory, psychomotor activity, such as a higher degree of agitation or slowness in activity. Is their speech slow, rapid, pressured, or halting, or normal? Do they have mood that's anxious, depressed, calm, or angry? Is their affect appropriate or inappropriate? It could be restricted, blunted, flat, or labile. Mental status also assesses thought content, which refers to delusions or paranoid, or whether a person is suicidal or homicidal. Their thought process, which can be affected by paying attention to excessive detail, or it can be tangential, have loose associations, or have perseveration. Is their judgment poor, fair, or good? What about their insight, their awareness of the problem that they're describing? When I was using a mental status exam in practice, I often added at this point an assessment of substance use or abuse. And as a social worker, I would be aware of asking questions that may be related to a history of abuse or oppression or disempowerment. For those who are interested in more information about the mental status exam, I have included this link in the comments, which can give you an idea about how to use a mental status exam with a client. This is an optional link for those who are interested to learn a little bit more. It's important to evaluate suicide whenever a client you're working with is depressed or agitated or upset about something, that it's important to assess lethality. So that includes suicide. It also includes wanting to hurt other people, in which you ask similar questions that are related to that. In evaluated suicide, you're asking about thoughts and feelings. Are you thinking of killing yourself? History. When have you thought this way in the past? Plan. How would you kill yourself? Intention. When would you do this? means is where would you get whatever item they had you had talked about in terms of plan that you would use, as well as imminency. Does the client seem committed to doing this? Is the client amenable to change, which is usually based on your own judgment and talking with the client. As I mentioned, this you can ask similar questions and also to assess a client's interest in hurting someone else. And it's important to recognize that asking these questions doesn't put this kind of suicide into the mind of a person, but it is something that's really important for us to assess. And when you're assessing and treating mental illness, it's important to examine symptom patterns and influential factors. While the DSM-5 diagnosis does not prescribe specific treatment, it is very useful in treatment planning and interdisciplinary consultation. Research that reports effective treatment for specific diagnostic categories is the most useful thing for guiding treatment. Interdisciplinary treatment is common. For example, a physician or a psychiatrist prescribing medication for the client, while another professional, such as a social worker or psychologist or psychiatric nurse, may provide counseling. The most common mental illness interventions are medications and counseling interventions. Both have pros and cons. Medication is often an essential component of treatment, and particularly may sometimes be necessary in order for counseling to take place because the symptoms are severe enough that the client has a very difficult time being amenable to counseling without some type of abatement of symptoms that comes from medication. On the other hand, medications can sometimes suggest that they will cure the mental disorder, which in many cases is not true. And therefore, it is something to be used as a management tool. Counseling interventions may help clients deal with the symptoms and manage the symptoms better, but it's important to recognize that you don't want them to focus on an unrealistic cure, that counseling is somehow going to take care of everything, since that's often not the case. Similar to medication, it's often a matter of managing symptoms. It's important to differentiate between the need for therapy and needing to link the client with ongoing support, such as self-help groups and family education, so that family can be more supportive once they understand the symptom patterns that their family member is going through. Research regarding many mental illnesses suggests that a combination of these two types of treatment, medication and counseling, are the most effective. It's important for social workers to recognize their local resources. Where can a person get emergency assistance or hospitalization or a lethality assessment? How can mental illness diagnosis occur? Supportive resources for those with mental illness, psychotherapy and counseling for those with mental illness, as well as family education and support and community education and advocacy. I'd like to talk at more length about the two most common mental illnesses that we see. That's depression and anxiety. And what do you look for? Well, both of them are mood disorders, so you're looking at the symptoms and the patterns of mood and affect. Are they due to a medical condition or substance use? Look at the symptom patterns and the progression of those symptoms over time. Are the symptoms a response to a stressor or trauma? Symptoms of depressed mood can include a poor appetite or overeating. They can include having difficulty sleeping or sleeping too much, low energy or fatigue, decreased interest in enjoyable activities, poor concentration, feeling hopeless or worthless, physical agitation or kind of a slowed physical presentation, thoughts of death or suicide. On the other hand, a manic episode is exhibited by clients showing inflated self-esteem or grandiosity, decreased need for sleep. They're more talkative or distractible, often have racing thoughts and psychomotor agitation. They can have an excessive involvement in activities that can lead to painful consequences. This can be, over shopping and buying things and going on buying sprees, as well as sexual activities. And these can result in a lot of difficulties for people. A hypomanic episode has the same symptoms, but they tend to have less impairment. There are several depressive or mood disorders. Major depression, persistent depressive disorders such as dysthymia, adjustment disorder with depressed mood, which is related to depression related to something very specific that's a stressor that's happened in the past 6 months, bipolar disorders, and cyclothymic disorder, in which the mood changes are less drastic and less impairing. Effective treatments for depression include medication, which is, as I mentioned before, is often necessary in order to try and get someone to the point where they can feel like they're able to do things about their life. Lifestyle changes and social support, psychoeducation and self-help groups, and psychotherapy such as cognitive behavioral therapy, behavior therapy, interpersonal therapy, or mindfulness-based cognitive therapy, to name a few. Electroconvulsive therapy has been found to be effective for treatment-resistant depression. I'm asking you to watch this video about Kevin when he describes his symptoms of depression. And while you're watching that, to look for what criteria for depressive disorder does he describe? And what do you need to know to help someone like Kevin? And jot down your ideas about this. Now to talk about anxiety, which is an apprehensive anticipation of future danger. It's about worry, it's about avoidance. It can include somatic symptoms or physical agitation, obsessive thinking, compulsive behavior. It can also include panic attacks, which are discrete episodes of intense fear in which a person has shortness of breath and accelerated heart rate and fears losing control. Other anxiety symptoms include phobias, which are an irrational fear of a specific object or situation. Obsessions, which are recurring thoughts or impulses that cause anxiety. Compulsions, which are repetitive behaviors such as tapping or touching or checking to see if something's turned off or turned on or whatever. And these person feels compelled to do these types of things in order to reduce distress or future consequences, negative consequences. Anxiety disorders include panic disorder, agoraphobia, social or specific phobias, generalized anxiety disorder, separation anxiety disorder, several obsessive compulsive disorders, as well as adjustment disorder with anxious mood. Like depression, effective treatments include medication, lifestyle changes, psychoeducation, self-help groups, and psychotherapy such as cognitive behavioral therapy, exposure therapy, and group therapy. When I was in practice, I ran a group that was basically psychoeducation and used cognitive behavioral techniques to help people learn how to manage their symptoms. So watch the video about Bree. And similar to Kevin, look for the anxiety criteria for anxiety disorder that she describes and which disorder she's describing and what you may need to know to help her. So you jot down your thoughts about that so that we can do an in-class exercise about this and consider what you've learned. I look forward to talking to you in class.